Hi everybody, I'm Dr. Jon LaPook and welcome to CBSDoc.com. I'm here in Chinatown with Dr. Perry Pong, who is the Chief Medical Officer of the Charles B. Wang Community Health Center. Did I get that right?
Yes.
Okay. And we're going to be talking about the intersection of Eastern and Western medicine, which happens right here on Canal Street.
Absolutely.
What happens here?
Well, we're a federally qualified community health center. We provide care for over 40,000 patients, over 200,000 visits a year, full spectrum of services, medicine, pediatrics, women's health, dental, mental health. So we really provide Western medical care to our patients. Most of our patients are Chinese, predominantly do speak Chinese, a lot are monolingual, and we provide culturally sensitive care for them.
Now, what does that mean, culturally sensitive care?
Well, hopefully we understand where they're coming from and that we can understand their experiences, their expectations, their ideas of medicine, and integrate that with Western medicine and the care that we provide.
Now, how do their ideas of medicine differ from, say, mine?
It depends. Many believe in theories of like yin and yang and hot and cold, which other cultures also believe in. For example, maybe if you have hypertension or high blood pressure, maybe you have excess yin, maybe you're too strong, too hot. So maybe I should take medication, or maybe I should drink herbs or teas to cool myself and my body so that I can lower my blood pressure.
So how does that translate to actually specific advice that you give? I mean, somebody comes in and you say, you have high blood pressure, and I'd like you to start this medication, and they push back a little, say, whoa, whoa, first I'm going to do something
Some people
else?
won't push back because that's not in the culturally allowed either. I'm the doctor, you're supposed to listen to me. So,
Will they not push back but then do what they're going to do anyway outside?
That may be very much so. So Confucian ethic might say respect your elders, respect authority, respect your teachers. They might be afraid to say that. So I'd have to tease that out of them, ask them, do you take other medication or other herbs or soups or see somebody else? Because we don't look down on it. We try to respect that and take that into consideration.
For example, if you prescribe a medication, a Western medication, and they're taking herbs, you got to know what those herbs are, right? Because there could be a drug.
Sure, if there's an interaction, we would like to know about it.
And that's one of the problems. That's one of the problems with Western medicine is, we'll come in, I'll ask my patients, are you taking any medicines? And they'll say A, B, and C, and they'll leave out the herbs and the supplements. Well, if I then specifically say you're taking herbs and supplements, oh yeah, boom, 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 boom. And I'll say, whoa, and there can be interactions.
There can be many different ingredients that you don't even know about. Practitioners of traditional Chinese medicine will have much more knowledge of those types of herbs, and also there's a whole tradition in China, and it's codified, and there's actually schools of traditional Chinese medicine that teach that as a science.
Let's talk about people coming from the East to the West and changing their risk factors for diseases. What have you been noticing with that?
Well, our pediatric department definitely sees the trend, as with other groups in the United States, of rising obesity. So for our patients, about 1 or 2 years ago, we looked at that, and over 25%, over maybe close to 30% were either overweight or obese for children. Many different factors, but particularly the Western lifestyle. With the lifestyle would come along higher rates for breast cancer, colon cancer, hypertension or high blood pressure,
heart disease?
Diabetes, heart disease. A lot of our patients work very hard. It's a hard life. Service economy jobs, restaurants, 6 days a week, 12 hours a day. It's a very hard life, just getting by.
Now you're trained where, in the United States?
Yes.
And were you born here?
Yes.
But where did you grow up?
I grew up in San Francisco, California.
But you speak Chinese, right?
I was getting better and better. Okay. I grew up speaking Chinese.
Right.
Well, when I grew up, the Chinese immigrants, the immigration patterns were a little different as well. Mm-hmm. So at that time, most of the Chinese immigrants were from Guangzhou region, Canton. And now it's really a mixture. So you have many people from Fujian, Shanghai, Wenzhou, other parts of China. Yeah, even people from different regions may have different cultures or beliefs. They may speak Chinese, but they also have their own sort of idioms and idiosyncratic ways about them. So that's also different and changes the culture of the Chinatowns in, say, New York or other places.
Now, you were trained traditionally, right?
Yes.
Where'd you go to medical school?
University of California at San Diego.
How's it like for you? You come in, you're examining Chinese. Some of them are used to the Chinese method, right? Now, how does the Chinese method of physical exam differ from the more Western method?
Well, Western method, we're checking your whole body. So Chinese, depending on what type of practitioner you have, maybe checking your pulse, your hands, making observations about your body, close and at a distance.
Your tongue?
All kinds of things.
Right.
I mean, they're really trained for different observations. Here, I'm very hands-on. I have my patients change for a physical exam, touching the body, drawing blood, urine, checking your blood tests.
So they're not used to that? Sometimes.
Actually, for the people that come here, that's a little different too. So most of them are, because they've had examinations, most of them before leaving China. But some may not, are used to it. And still there's beliefs about drawing blood. For example, well, it might not be replaced. You're going to make me weak, so don't take too much.
And what about examining the body? What kind of things do you push up against there, examining somebody from head to toe?
Actually, most people are appreciative. Most people feel like, wow, you're taking an interest and that's the way you do it, and that's fine.
Now in China, the person might not get undressed, right?
It depends, right? Depends if they're trained in Western medicine or...
So when somebody comes here who's, say, older, and then you say, I'm going to do a complete head-to-toe exam,
Sure.
What kind of response can you get?
Well, if they come here, though, then they might expect that.
There's been a flow of medicine from west to east, too, right?
Absolutely.
So in China, there's Western medicine
Yes.
and there's Eastern medicine.
Yes.
And here, there's Eastern medicine and there's Western medicine.
And there's mixture, combinations. So if I see a patient, I might ask them, are you taking any other medication, including herbs or other preparations that people may not consider medication? We respect and understand people, and we do have people speak the language and understand culturally what people, believe in, and listen to that, that we're not going to put that down, or, we might say it's not the best for you, or that you need something stronger, but, that we listen to you. That goes a long way. A smile, someone listening to you and willing to take that time, I think that's our message.
And that really is the same message that all doctors should have, right?
Absolutely.
I mean, whether it's Eastern medicine or Western medicine, it comes down to listening, being compassionate, empathetic, trying to think logically,
Yes.
and being thorough. So we hope you learned something with this conversation. Thank you so much to Dr. Perry Pong.
Thank you for coming down.
And thanks to all of you for joining us. Good day and good health.